Nervive Nerve Relief claims to assist with age-related neuropathy, a condition affecting the nerves, causing weakness, numbness, and pain, particularly in the hands and feet. The big question is, can it genuinely deliver results in just 14 days, and is it worth considering? Let's take a look at the ingredients. Here are the doses per capsule. The recommended dosing is 1 capsule per day. We're going to analyze each ingredient to see whether they contain a sufficient dose, whether it contains the active compounds to work, and how effective they may be for neuropathy. Let's talk about B vitamins and their role in supporting nerve health. These vitamins are essential for various physiological processes that keep our nervous system functioning properly. For example, thiamine, or vitamin B1, is crucial for energy production in nerve cells, while peroxidine, or vitamin B6, assists in the formation of neurotransmitters, which transmit signals between nerve cells. Vitamin B12 is vital for DNA and RNA production, key components for nerve cell growth and repair. Now, we've established that these nutrients are important for nerve health, and a deficiency can lead to nerve issues. But what about using higher doses than normal, also known as therapeutic doses, to address neuropathy? Unfortunately, the research is weak, and the most substantial evidence supports using large doses of vitamin B12 for neuropathy treatment. The problem with products like Nervive is that they don't provide therapeutic doses of B vitamins. The amounts are too small for therapeutic use and are only really sufficient for addressing deficiencies. So if you don't have a B vitamin deficiency, it's unlikely that taking B vitamin supplements will help with your peripheral neuropathy. Now let's touch on calcium. While it's associated with nerve function, there's no compelling reason to believe that supplementing with calcium is beneficial for nerve issues. Its presence in Nervive might be for reasons like controlling pH or enhancing overall stability of the supplement, but the evidence supporting calcium supplementation for nerve health is completely lacking. Alpha-lipoic acid, or ALA, is an antioxidant naturally produced in our bodies and can be found in foods like red meat, organ meats, and vegetables. Research shows that taking ALA, especially in doses ranging from 600 to 1,800 milligrams daily, may help reduce symptoms like burning, pain, numbness, and prickling in individuals with diabetic neuropathy. There's also some, although weaker, evidence that ALA might be beneficial for chemotherapy-induced neuropathy, although its effectiveness could vary depending on the type of chemotherapy. When it comes to Nervive, ALA is the key player in its effectiveness against neuropathy. It's important to note that the 600 milligrams of alpha-lipoic acid in Nervive is considered on the lower end of the effective range. Higher doses within the 600 to 1,800 milligram range have shown more significant positive effects in addressing neuropathy symptoms. Turmeric, specifically its active compound curcumin, is thought to have potential benefits for neuropathy due to its anti-inflammatory and antioxidant properties. Ginger, known for its traditional analgesic effects, is also considered a potential aid in relieving neuropathic pain. However, there are two main issues with Nervive in this regard. Firstly, the doses of both turmeric and ginger are too small to have a meaningful impact. Effective doses are typically in thousands of milligrams, not the 30 milligrams provided by Nervive. Secondly, the research supporting the use of these herbs for nerve issues is weak, and most research is limited to studies on cells and mice, not humans. When it comes to safety, any issues with Nervive are likely linked to the alpha-lipoic acid it contains. Alpha-lipoic acid might cause a heartburn-like feeling, abdominal discomfort, or a bitter taste, especially on an empty stomach. However, these effects are usually associated with higher doses, and the 600 milligram dose in Nervive is likely to be well tolerated by most people. Taking alpha-lipoic acid orally has also been linked to around 50 reported cases of insulin autoimmune syndrome, or IAS, a rare condition causing low blood sugar. This occurs because the body begins to make antibodies to attack insulin. This issue is mainly reported in Japan and appears to have a genetic predisposition. Therefore, it's likely only a small subset of people may be at risk. Nervive is essentially an alpha-lipoic acid supplement. The other ingredients in it have doses too low to be beneficial. Alpha-lipoic acid is most effective for a specific type of nerve issue known as diabetic neuropathy, caused by damage to nerves and blood vessels from diabetes. Studies indicate that it usually requires 3 to 5 weeks for ALA to show improvements in diabetic neuropathy, which is longer than the 14 days Nervive claims. However, while ALA may initially offer benefits, these effects could diminish over time. Longer-term research suggests that after 6 months of use, the advantages of ALA might decrease. So if you're dealing with diabetic neuropathy, Nervive might be helpful, but it's less likely to be effective for age-related nerve issues. Also, don't expect quick results. It's more realistic to anticipate positive effects closer to a month, given that Nervive uses lower effective doses, and these benefits may not last past 6 months. Nervive comes in different forms, but I'm primarily focusing on Nervive Nerve Relief. The other versions are quite similar, with some minor tweaks. Nervive Nerve Relief PM is designed for nighttime use. It contains the same amount of alpha-lipoic acid, but includes 2 milligrams of melatonin. While it also has some calming herbs, the doses are too small to have a meaningful impact. It's likely to be similar to regular nerve relief for neuropathy, just with added melatonin to aid sleep. Nervive Nerve Health is positioned as a supportive formula with more B vitamins but less alpha-lipoic acid. It's likely to be less effective than regular nerve relief for neuropathy, and in my view, may not be worth it because if you're seeking additional B vitamins, it's probably more practical to opt for a separate dedicated B complex supplement. When we compare alpha-lipoic acid supplements, such as Nervive, to medications like Gabapentin or Lyrica for nerve pain, research suggests that ALA may be comparable to many of these medications. One study compared Lyrica or pregabalin to ALA, revealing that ALA reduced pain scores from 5.32 to 3.96, while Lyrica reduced pain scores from 5.32 to 3.25. That's pretty close in effectiveness. In another study, patients switched from ALA to Gabapentin or other medications. The results indicated that during the alpha-lipoic acid treatment period, visits to the doctor occurred on average 3.8 times per 3 months, while it increased to 7.9 times per 3 months after switching to Gabapentin or other pain medications. This suggests that the drugs led to more doctor visits, potentially due to higher rates of side effects, and may not have address the nerve pain much more effectively than ALA. So these studies suggest that alpha-lipoic acid does a commendable job in addressing nerve pain, possibly on par with many medications. Nervive Nerve Relief is selling for around $20 per month. If I want to replicate its effects but better, I would combine alpha-lipoic acid with vitamin B12. Generic alpha-lipoic acid is around $3 to $4 per month. B12 is also around $3 to $4 a month, so getting generics individually will cost around $6 to $8 a month. Rating Nervive by effectiveness for neuropathy, I'm giving it a B. It contains ALA, which is moderately effective for neuropathy. Just keep in mind that it's best for diabetic neuropathy and uses a lower effective dose. Rating it by cost, I'm giving it a C. Nervive can be easily replicated at a much cheaper cost by getting the generic ingredients individually. Rating it for safety, I'm giving it a C. It's relatively safe to take, however ALA can interfere with certain medications or cause some people unwanted digestive issues. Overall rating, I'm giving a C. If you suffer from diabetic neuropathy, Nervive could be helpful, however it is overpriced and I would recommend you just take generic ALA at a higher dose if you can tolerate it. Hi, I'm Dr. Brian Young. Do you think it's worth it? Let me know in the comments down below. And if you found this video helpful, please subscribe to the channel and leave me a like. Hit the notification bell if you want to stay up to date. And share this video with someone you know can use the info.